I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello and welcome to another episode of Boomer Health at Home. I'm your host, Ryan Donnellan. Joining me to my right is a man who's voted best beard in public television, Brett Pulte.
You know, it's a very distinguished honor, and I'm very happy to have won this.
Well, we're happy to have you here, sir. So what are we talking about today?
Today we have our friend Joyce Ward joining us again, and Joyce is going to be talking about case management and how it can help someone that needs it.
That's very interesting. I know the case management is kind of one of those roles that people aren't as familiar with, so it'll be interesting to learn more about it. So
no, it definitely will. And Joyce is a certified case manager, and she's going to take us through the different ins and outs of what a case manager can do, how they can help someone who has a medical necessity at home, and she's really going to educate us on everything about it.
Well, sounds great. Sounds like we got a great show today. So don't go away. When we return, we'll talk to Joyce, learn some more about case management, and hopefully answer some of your questions. Welcome back to the show, and please join me in welcoming back our special guest, Joyce Ward.
Thank you.
You're welcome. Thanks for being here. And now, in previous episodes, you had mentioned you were a case manager, and we actually did receive an email about that from one of our listeners saying that she cares for her mother at home and is wondering how a case management service could help her situation out. I know that case managers work within the hospital system, so we thought maybe today we could talk about ways hiring an independent case manager may help someone in the in-home market as well.
Right. As you said, most people in their day-to-day life become familiar with case managers on the hospital level. You would probably call them a discharge planner and so forth, and their job is to transition you back into your community or wherever it was that you were before your hospital stay. But because of the efficacy of care management, they have found that it really can decrease the cost of administering medical care, make sure you have appropriate medical care, and can assist the patient and family in navigating through the maze of medicine that we now have as our healthcare system. And most people aren't aware that you actually can hire an external case manager or a private case manager to help you. And this is becoming much more in vogue lately because of our mobile society. A lot of people do not live even in the same state, let alone the same city as their parents do these days. And it becomes increasingly difficult for you to help your parents as they age and become less and less able to care for themselves. And this is where a medical case manager could be of great value to assisting the family.
Now, can you explain to us what a medical case manager actually does for their clients?
Yes, they would help you understand, number one, the patient's condition. They can do a home assessment and find out what their needs might be. How are they functioning in their activities of daily living, bathing, ability to administer finances, keep their house clean, and so forth. Arrange transportation to and from doctor's visits. If necessary, accompany the patient to the doctor's visits. Communicate that to the family if that's what you need them to do. And just a multitude of things, and making sure that the care that the patient is receiving is appropriate, making sure their medications are managed properly, making sure they have appropriate home care services in place to assist them as well.
That sounds great. So it sounds like there's a lot of advantages then for family to seek out a case manager. I mean, certain things come up that, I mean, the family may feel uncomfortable handling, like hygienic
Right.
stuff, for instance. So what are some other advantages that a family could gain from having a case manager?
Well, you have the most case managers are nurses that have a 2-year or more degree all the way up to a doctoral degree. So they're very educated as far as medical care, appropriate medical care. They're able to educate about illnesses and so forth because they have that clinical understanding. They're able to assess the medications, make sure they're appropriate. If a specialist is required to assist in some cases, they would be able to make that assessment and assist the families in selecting the appropriate specialist to go to. There's just a whole bunch of things that they can kind of help you understand or help you navigate. They're really, a good word for them would be navigators. They can help you navigate through the maze of insurance, what's paid for, what's not paid for, what you need to plan for, what private duty services you may need. They're your go-to person to help you decide those things.
That's great too, especially if someone doesn't. I mean, we talked about families, maybe they live out of state. If someone doesn't have a family, this could be a good service for them as well, thinking, hey, now you have someone to turn to help manage your own personal stuff when you don't know what to do.
Absolutely.
Someone to turn to.
Yeah, and it really helps the patient maintain their sense of independence.
Yeah.
You know, sometimes a lot of people in nursing homes could be home if they just had that little bit of help, you
Yeah.
know, and keep them in their own environment, keep them independent for much, much longer than, you know, we don't really do a good job here of helping our elderly people function in the community, so.
And like you said, you know, you've been saying that, you know, case manager is more of a navigator, and, you know, rather than telling people, it's helping people. So what situations would require a case manager more than others?
Well, a new onset illness would probably be one of the things, and it's usually precipitated by a hospital stay, maybe a new heart condition, congestive heart failure, chronic pulmonary obstructive disease, diabetes, which really entails a lot of management at the home level. Inability for somebody to perform their activities of daily living, maybe, you know, arthritic, they're not moving that well, they're starting to shy away from the bathroom a little bit, and those kind of things. Lack of support from friends and family. You may not have anybody that lives around you, or you may not have anybody, period, and, you know, it's time that you need some help with those things. Social isolation, you know, inability to drive anymore, those kind of things are all kind of red flags that maybe you need a little bit of help, and you need to plan out for long term. So those would be cases where a medical case manager could really help out.
Now, I've seen also cases too where it seems like it's almost like a court-ordered appointed case manager on the case. What are some of the situations that would dictate bringing in a legal advisor or petitioning to the court?
Okay, that, you know, when you notice that your loved one is just not making good decisions anymore, maybe falling prey to predatory practices, scams on the phone, financial problems, inability to pay bills, and those kind of things. You know, my mom had a big penchant for giving money to people that called her on the phone, and those kind of things, you know, that you really have to kind of watch out for. I mean, these people are really vulnerable at this point, and you need to protect them. So in those cases, it gets a little more complicated. Getting legal guardianship over somebody is something that the courts do not take lightly. Okay, anybody can, if you deem somebody not capable of functioning in the regard of the things that we talked about before, there's a specific legal procedure. Getting a medical decision making is a little more cut and dry. There's really two separate things: medical decision making, and then there's legal guardianship, where you would have guardianship over the person's finances. Medical decision making is something that does not require court appointment. Most families that I have run into will allow they designate another family member in the case that they become incapacitated, to make decisions for them. Every time you go to the hospital, they ask you that question right up front, okay? So there's something on record usually as far as medical decision making goes. Financial decision making is another story. That's something that the medical case manager can assist the family with. You can file, you don't necessarily need an attorney for that. You can file in court, and the person may be resistant to somebody taking over their life like that. They
Right.
view it as a loss of independence, but sometimes you have to do what you have to do.
Yeah.
You can file in court. The filing fee, you can download the paperwork and the application and the instructions on any county courthouse website, okay, waynecounty.gov, oaklandcounty.gov will have a section that will explain the procedure to you. The filing fee is usually $150. You turn it in and you would get a appointment for a hearing. But you do have to be prepared. As I said, the courts do not take this lightly. There's cases of family members trying to take over people's finances or get at their money or whatever, and they're still perfectly capable of doing that. So the court will require a letter from a physician. A psychiatric evaluation is helpful. If the person is hospitalized and is incapacitated, you can request your clinical treatment team at the hospital to do a psychiatric consultation to determine competency and so forth. But you do have to be prepared when you go into court to do that.
Right. So a perfect time to call in the navigator, like we said, to help you get prepared.
Right.
So makes all the difference.
Yeah, and in situations where, like we've stated before, we're in such a broad society where we're connected by everything, so you can almost feel like you're next to someone, even not even being in the same state as them. So, what do you recommend for children who live out in a different state or far enough away from their parents that they can't help them? What do you recommend for them to do in those situations?
That would be a case where a medical case manager would be really helpful. You can contact them and have them do an assessment, an in-home assessment, and so forth. You can usually negotiate, depending on what the person needs, how many hours. Generally, there's an hourly billing rate of $45 to $55 an hour, or some medical case managers will do a package of, a certain amount of monthly services, assessments, in-home visits, and, it depends on what the requirements of that person are. Some people need much more care than others, and some just may need 4 or 5 hours of oversight. But that's the person that you can count on to make sure all the services are in place, that the appropriate services are in place, and reputable services are in place. So that would be really a godsend to a lot of people that are worried about their parents.
Yeah, that's great. And I know you kind of mentioned that you do this a little bit, but could you just elaborate a little more on what the role of a case manager is in kind of monitoring the care from other physicians? 'Cause I think some families may think, hey, well, they're already seeing their doctors, they're already doing this, but missing kind of the navigation element. So what does the case manager and what can they bring to monitoring this?
I've seen this a lot at the hospital level. That there's a huge, I think everybody's heard the term fragmentation of care. A lot of people are getting duplicate services, duplicate medications, multiple doctor visits, polypharmacy, taking way too many medications for the same thing that they really only need to be taking one for, those kind of things. So they're like the filter that makes sure that you're not overdoing it, underdoing it, and that the people that are doing it are the right people.
And as you said, with the case manager being able to oversee a lot of that, and you also stated previously that a case manager could possibly, take a patient to a doctor's appointment, things of that. So, what advice do you give to your clients before they head to the doctor? When they're preparing, what should they really be preparing for?
Well, they should have a basic understanding of what the diagnosis is. When they're going to the physician, they should have a list of medications that they're taking. They should have a list of their recent medical history, surgeries, and so forth. Most hospitals now will print, you can go online and print off the hospital stay visit. Most doctors are giving you what's called an after visit summary. You should always have a primary care physician that oversights the care, and not just a series of specialists or doctors or here and there kind of patchwork medical care. You should make sure that your doctors or your specialist visits send that information back to your primary care physician or your medical case manager for disbursement, and just kind of making sure that everything is coordinated.
It's great. You hear a lot of times about people saying, tell your loved ones to keep a health journal, and so okay, that sounds interesting. But what do they need in this journal? Because I think some people maybe do you want like a narrative? It was the best of times. It was the worst of times. I mean, what should someone write in these journals?
Well, we said the medication's very important. Times, amounts, how long they've been taking it, a list of diagnoses of any medical conditions they may have, congestive heart failure, COPD, diabetes, any surgical procedures that you have had done. It doesn't have to be a book.
Oh, okay.
But the doctor needs to know, you may be taking this medication, it may interact with another medication that they were planning on giving you with disastrous results. So it's very, very important. You should always also make sure that you use one pharmacy and not go to multiple pharmacies to get your medications, because they oftentimes can flag things or problems as well.
Yeah, and that's an interesting point. You said, using one pharmacy, because generally you have to get your prescriptions refilled each month or every 3 months in some cases. So, like you said, a case manager can stop in and, check in on their patients. Well, pharmacists can, basically look at them all, at least once a month or so. They can see maybe that medication's not working right. That's a very interesting point. Speaking on that though, what additional resources can a case manager offer their clients?
Well, they can definitely coordinate all of that care. They can be the pipeline of information, and again, they keep track of that, and then they can report that back to the medical decision maker for the patient. So definitely a clearinghouse for information. And a lot of times they can nip things in the bud that could be a problem, and they can also help you with long-term planning. That certain conditions you're going to decline. If you have dementia, you're going to decline. Your level and your need is going to go up, and
Right.
they can help you find the resources.
Well, naturally, if you don't have the credentials, the RN, CCM behind your name like you do, even though you may think you're doing the best for your loved one, you don't have the training that the case manager can bring you just naturally. I mean,
Exactly.
Ignorance is not bliss in this situation. You don't want to make any mistakes.
Yeah,
so.
many families just, when the first major illness occurs with a family member, find out very quickly they're in over their head,
Yeah.
and they need help. And the hospitals do the best they can, but they can only do it in the hospital. You kind of need that transition into the community type of care and management, especially
sure.
if you're not around to help them.
Right, and you had mentioned too that the change can happen quickly. It may be, the decline, can really happen quickly. So from the hospital to the home, so you kind of need someone to be there watching it. Obviously, now we're going to put sales hat on. If someone's looking for the service, what does a case manager typically charge? I think that's probably on everyone's mind right now.
Yeah, it's usually probably $45 to $55 an hour, but you may only need 3, 4, 5 hours a month for things to be reviewed, and I think everything's negotiable in the private pay arena as well.
Sure.
You could have a package of services per month. I'll do this medication review, go to the doctor or whatever, but you should work that out with your provider, before you actually contract for the services. So
well, yeah, and you weigh that cost, to a little over, almost just shy of $200 there, or what's the cost of readmittance or things?
Thousands.
Yeah, it's kind of a essential part of that prevention.
It's also good to make sure that your case manager is credentialed. I wanted to just speak to that for a couple of minutes. There's Generally two large recognized credentialing bodies in the United States for case management. You should make sure you always have a certified case manager. CCMC is the Commission for Case Management Certification. That's who I am credentialed by. It requires a secondary postgraduate degree, ranging usually BSN up to a doctoral degree in nursing. You are required to have a minimum of 24 months of experience in case management full-time, and you have to be recertified with over 100 hours of educational experience each 5 years. The other one is the American Case Management Association. It's another recognition, and they're essentially the same requirements for that one. So you should make sure when you do contact somebody as a medical case manager that they are certified and current.
And that's very important, especially, like we've always said, you don't want just anyone coming in and helping your family member. You want to make sure they're a good professional who is up to date on their education. So, in that vein, how can someone find a reputable case manager?
Well, we can help you with that at AmeriCare Medical, Boomer Health. You can contact us, either at our telephone number or at our website. You can contact the two credentialing bodies that I mentioned. They do keep a list of current people that are credentialed by them, and that's CCMC or the ACA.
Perfect. Well, I think I can safely speak on behalf of everyone, hearing what you do. Thank you for being an advocate for all patients, knowing what that job does, and it's really an important job, and I think it's a very noble work as well. So thank you. Of course, all nurses as well, thank you, but especially this. I thought it was very interesting to learn about really the details of the case management, but unfortunately we are out of time, but thank you for being on the show. Thank you for all you do, and again, if anyone has any questions at home about any of the content you've seen on this show or our previous episodes as well, please contact us at area code 248-288-2270, or you can send us an email at boomerhealth@americaremedical.com. Thank you very much, and thanks for watching.